Good day, I'm Stephen McHugh, and this is your JIS News for Friday, April 1, 2022. The Statistical Institute of Jamaica, Statin, is officially reporting that the country recorded a 6.7% growth outturn for the October to December quarter of 2021 as the island continues to rebound from the impact of the COVID-19 pandemic. It is a 1.4% increase over the July to September period and the sixth consecutive quarter of growth since a 15.6% decline in the June 2020 quarter. Statin gave the updated report in a statement on Thursday. The agency says the expansion in economic activity for the review period was driven by growth of 9% in the services industry and 0.5% for the goods-producing industry. For the services industry, the top performers were hotels and restaurants, wholesale and retail trade, repairs, installation of machinery and equipment, transport, storage and communication, and other services. Within the goods-producing industry, there were higher outputs for agriculture, forestry and fishing, and construction. According to Statin, the economy was positively impacted by the relaxation of some COVID-19 measures, including the easing of global travel restrictions and reduced curfew hours. Preliminary estimates for the 2021 calendar year show that the economy grew by 4.6%. The Jamaica Manufacturers and Exporters Association, JMEA, and the Jamaica Stock Exchange, JSE, are partnering to give small businesses greater access to capital. The two entities recently signed a Memorandum of Understanding, MOU, to enable micro, small, and medium-sized enterprises, MSMEs, that are members of the JMEA to list on the junior equities market. Minister of Industry, Investment and Commerce Senator Aubin Hill has endorsed the move, which he says is important for enterprise development and economic growth. In light of conditions such as the war in Ukraine and rising prices for commodities such as fuel, fertilizer, and food, the minister says businesses must now look locally and regionally to provide products that would normally be imported from farther afield. Managing Director of the JSE, Dr. Marlene Street Forrest, says that through the MOU, it is expected to have over 100 companies listed on the junior market in short order. Dr. Street Forrest says all companies that have come to market have been oversubscribed, which is a reflection of market liquidity, adding that the best time for any company wanting to list is now. 3 UN agencies and the Ministry of Labour and Social Security have launched a new intervention to lessen the impact of COVID-19 on the most vulnerable and enhance Jamaica's social protection system to better respond to future shocks. The United Nations Children's Fund, UNICEF, the United Nations Entity for Gender Equality and the Empowerment of Women, UN Women, and the World Food Programme will be implementing the $1.1 million joint program. It's called the Modernization of the Social Protection Systems in Jamaica towards an adaptive, shock-responsive, inclusive system. According to a statement from the Ministry of Labour and Social Security, the joint program will introduce tools to better identify persons who face acute socioeconomic challenges due to major shocks such as pandemics and disasters. It will also strengthen government's mechanisms and systems for providing support to these persons. A key innovation will be the piloting of electronic payments to enable more efficient and faster payments, particularly to persons with disabilities. United Nations Resident Coordinator Dr. Gary Conneal says the joint program will help enhance Jamaica's rainy day protection, especially for female-headed households and women working in the informal sector and families with children and people with disabilities. It's being implemented in the context of global evidence showing that vulnerable groups are disproportionately bearing the burden of the health and socio-economic impacts of the COVID-19 crisis, particularly women and persons living in poverty. Minister of Labour and Social Security Carl Samuda says the initiative marks another important milestone in accelerating Jamaica's efforts to become a more inclusive and socially adaptable society. It is funded through the Small Island Developing States SIDS grant funding initiative. 30 schools will benefit from an energy efficiency and solar pilot project to reduce electricity costs by 40 to 70%. The school's Energy Efficiency and Solar Pilot Project is a public-private partnership to be implemented by the Ministry of Education and Youth, the National Education Trust, NET, and Canada-based renewable energy company Roswell Development, Inc. The parties signed a contract at the Development Bank of Jamaica, DBJ, in Kingston on March 29. Education Minister Fable Williams says the pilot project is in line with government's focus on incorporating solar power as part of its thrust to enhance energy security in the country.
We certainly will be encouraging our schools that are part of this project to treat it with seriousness and at the same time to work with other public education institutions to adopt and implement measures that will reduce their electricity bills.
Managing Director of Roswell Development, Inc., Daniel Roscoe, says that in taking on this project, Jamaica can lead the Caribbean in a new way.
Jamaica has succeeded where others have failed, and now has the opportunity to lead the Caribbean in a new way to manage energy. Financed energy retrofits help reduce the cost of energy, help improve the efficiency of the use of that energy, and help make infrastructure more resilient in the face of climate change.
The Energy Efficiency and Solar Pilot Project was developed through a partnership involving the Development Bank of Jamaica, the Ministries of Finance and Science, Energy and Technology, and the Attorney General's Chambers. Starting today, the Southeast Regional Health Authority, SERA, will take over the management of the St. Joseph's Hospital in St. Andrew. This transfer follows a cabinet approval in January 2021 for the Ministry of Health and Wellness to hand over the management of the facility to SERA. The Regional Health Authority will be responsible for the management and operations of the hospital in keeping with the provisions of the National Health Services Act. According to a statement from SERA, the transition is part of the ministry's objective of delivering client-centered, efficient and accessible health care. As a result, the hospital will be redeveloped as a center of excellence in oncology and nephrology, operating as an extension of the Kingston Public Hospital. This will see the phased relocation of certain oncology, nephrology, and ambulatory services from the Kingston Public Hospital to St. Joseph's. In the meantime, the hospital will continue to operate as a permanent COVID-19 vaccination site and provide urgent care services. SERA says there will be no impact on the delivery of radiotherapy services at the National Cancer Treatment Center, which is located on the hospital compound. And finally, persons are being warned that it is illegal to work as a nutritionist if you are not registered with the Council of Professions Supplementary to Medicine. Regional dietitian at the Western Regional Health Authority, Dr. Rosalie Brown, gave the warning as she addressed the JIS think tank at its Montego Bay office recently. She says it is also important to note that there are different training requirements for dietitians versus nutritionists.
But what is most important, it's not just having that basic training at a university level. They must be registered with the legal counsel in Jamaica. So we'll have many Jamaicans who have basic training and they're going around saying they're nutritionists. It is illegal unless they are licensed with the Council of Professions Supplementary to Medicine.
The JIS think tank was held to highlight the Jamaica Association of Professionals in Nutrition and Dietetics, JAPINAD's 20th anniversary being celebrated all year. JAPINAD is a non-profit professional organization that represents all practitioners in the field of dietetics and nutrition. Its members are employed largely to the Ministries of Health and Education, tertiary institutions, and in the private sector. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.